Hello everyone, Sat Shri Akal, Saranu. This is Navjeet Kaur. You can follow Eagle Academy and you can also join me for online Nclex coaching classes. Today I am back with a memory trick that is related to tocolytic agents. So first of all, what are tocolytic agents? Tocolytic agents are drugs that we use to delay labor. Basically, these drugs are used in case of preterm labor, or these drugs are used in clients who are having any contraindication for normal vaginal delivery. For clients in which we have to go for C-section, we have to stop or delay the labor process in those clients, so we use these tocolytic agents. The action of tocolytic is against the oxytocin. As oxytocin induces the uterine contraction, tocolytics will suppress those uterine contractions. I am here with a sentence that you can learn to memorize these tocolytic agents. So that sentence is not to induce my labor. You have to pick first letter of each word present in this sentence. So first word we have is not, so we have to pick up N from that. N stands for nifedipine. Nifedipine is a calcium channel blocker that we use to treat hypertension in our client, and it also reduces the heart rate in our client. We know for muscle contraction our body or muscle cells need calcium, and this drug will block that calcium. This drug will stop that calcium transportation, hence will suppress the uterine contractions also, and similarly it will also suppress the heart muscles from getting contracted and will decrease the heart rate as well. Next word we have is T. T stands for terbutaline. This is the first choice of drug. Basically, terbutaline is a bronchodilator that we use in clients suffering from asthma and COPD. It is also used to suppress labor process, and this one is the first choice of drug. This drug will suppress the sympathetic nervous system, that means flight and fight mode, hence it will suppress the labor process and delay the labor in our client. Next drug and next word here is induce. So take I from this induce. I means indomethacin. Indomethacin, basically it is a non-steroidal anti-inflammatory drug, and this is used to treat pain and inflammation in any client, used in clients who are suffering from arthritis like condition in which we have to treat pain and inflammation. This indomethacin is also preferred to use as a tocolytic agent. There are few points that you need to know for Nclex about this indomethacin drug. Indomethacin is not prescribed to patients whose labor is in progress from last 48 hours, and these drugs are not given to clients whose gestational age is less than 32 weeks. So keep this in your mind and note it down. This medicine can be administered directly also. Okay, now the last drug under tocolytic agents is not to induce my labor. So here M stands for magnesium sulfate. Magnesium sulfate, it is a very important drug. Magnesium sulfate is used as antidote for calcium gluconate, as this will also block the flow of calcium to the muscle tissue, hence will suppress the contraction. Same, this will have effect on heart muscles also, and same on the other body muscles including uterus. This is how it will suppress the uterine contraction. This is again a very important drug to know for Nclex. The Nclex tip about magnesium sulfate is, if you are going to administer magnesium sulfate to any of your client, either you are administering it for suppressing labor, you have to always have calcium gluconate available on patient's bedside, because it is an antidote for magnesium sulfate. Whenever you are going to administer calcium gluconate to your client, if client is having any cardiac emergency, then you have to have magnesium sulfate available on the patient's bedside all the time. So these are tocolytic agents. I hope you get to learn, and I hope this memory trick will help you to remember these tocolytic agents. Thank you so much.